Okay. Good evening, everyone. My name is I am Dr. Xi Jielin. Thank you for being here today as we explore a topic that significantly impacts the lives of many individuals, vestibular syndrome. And I will focus on the laser therapy and acupuncture. This is my outline today. I will introduce vestibular system, vestibular syndrome, traditional Chinese veterinary medicine, acupuncture, laser therapy, and acupoints. The last part is case reports. First, let's talk about vestibular system. The entire vestibular system is located within a portion of the ear just past the eardrum, called the middle ear. Within the middle ear is a smaller area composed of many interrelated structures, collectively known as the inner ear. And vestibular portion of the vestibulocochlear nerve, the brainstem, and the vestibulocerebellum. The vestibular system controls balance and tries to prevent the animal falling over. Control of balance requires tiny changes in the position and movement of the body and the eyes depending on the position and movement of the head. The balance sensors detect the position of the head in space while the animal is standing at rest or when it is moving. The information on the position of the head is converted into electrical signals which are sent to brain. The balance control center in the brain processes this information and sends messages to the rest of the body to keep the animal upright. Messengers are also sent to the muscles controlling the movement of the eyes to change the position of the eyes according to the position of the head. Then, what is vestibular syndrome? Common signs of vestibular syndrome in dogs and cats, including head tilt. Head tilt means rotation of the head with one ear held lower than the other. The second one is body leaning. The third one is nystagmus. Please see the video. Nystagmus means flickering of the eyeball from side to side or up and down. The next one is general wobbliness or ataxia, often with the animal drifting to one side as it moves around and inducing falling, rolling, and circling. The balance center is very close to the area of the brain what controls vomiting. So animals with disturbance to the vestibular system may also feel nauseous, make animals draw or vomit often. Vestibular syndrome in dogs and cats can be caused by a disease affecting any parts of the system, including sensors within the ear, the nerve connecting the ear and the brain, or the control center in the brain. Conditions affecting the ear include deep ear infections, ear tumors, or polyps. Damage to the skull, such as caused by a road traffic accident or a bad fall. Diseases affecting the vestibular nerve, including nerve tumors, nerve inflammation. The next one is shock, hyperthyroidism, and some vitamin deficiencies. For example, thiamine deficiency. Some toxins or antibiotic treatments can also cause vestibular syndrome. Some animals, particularly old dogs and cats, develop vestibular syndrome and yet no cause can be detected, despite extensive investigations. This is called idiopathic vestibular disease. There are several other diseases that can cause similar symptoms. So it is important to try to confirm the presence of a vestibular syndrome in dogs and cats. And then to identify its cause in individual patients, first, we should perform a neurological examination to determine if the problem is more likely to be within the ear or the brain. Disease located in the brain is often called central, while disease of the nerve is called peripheral. Nerve or peripheral disease is generally self-limiting or easily treated. However, disease of the brain can be life-threatening, especially when left untreated. The ear should be examined with a scope and a swab taken if an infection is suspected. Many dogs with vestibular syndrome may have no typical signs of ear inflammation, such as head shaking, scratching of the ear, inflamed ear canal, or inflamed eardrum. And we should do a blood evaluation to confirm or deny other systemic infections or blood-related abnormalities like anemia. That may also cause stumbling similar to vestibular disease. Other investigations such as X-rays, CT scans, or best of all, MRI scans can help to detect disease located behind the eardrum, such as a deep ear infection or a tumor. CT and MRI scans of the brain are also useful for detection of brain disease. Because vestibular disease is caused by an underlying condition, so we should treat the underlying condition first, and then control the effects of vestibular disease with supportive care. Supportive care for vestibular disease is based on the symptoms, including anti-nausea medication and IV fluids. Anti-nausea medication to decrease vomiting and help with motion sickness. In animals with significant nausea and loss of balance, medicine that used to control motion sickness may help reduce symptoms, but treatment of the underlying condition is also required. If the patient is very nervous and cannot relax, we may use sedatives to promote relaxation and reduce anxiety. In my clinic, I usually use laser therapy or acupuncture to make a vestibular syndrome recover more quickly. I will introduce this part in detail later. Overall, the prognosis of vestibular disease is good if the underlying cause can be resolved. Most dogs that are diagnosed with vestibular disease start to improve within 1 or 2 weeks and often return to normalcy within 1 or 2 months. However, some of them may develop a permanent head tilt or may have continued episodes of ataxia. During recovery at home, it is important to provide a calm and quiet environment free of potential dangers, such as pools, stairs, or items that may cause injury. A recurrence of vestibular disease is possible. However, neither symptoms is life-threatening, and animal can go on to live a normal life. Before introducing acupuncture and laser therapy, I will talk about some basic theories of traditional Chinese veterinary medicine. The basic theory of traditional Chinese veterinary medicine attempts to explain the nature of the life cycle and disease changes. It includes 5 theories: yin and yang, the 5 elements, Zhang Fu, meridians, qi and blood. It also researches dialectics and explains why disease occurs. how to diagnose and prevent diseases, and how to keep the body healthy. These are abstract theories that are difficult to explain easily, so I will just briefly top up them. Someone may ask, what is qi? Qi is the vital energy that is believed to circulate throughout the body and to be necessary for the proper functioning of the body's organs and systems. Symptoms of qi imbalance may include fatigue, shortness of breath, and digestive issues. Blood is the vital substance that is believed to nourish and support the body's tissues and organs. Treatment for qi or blood imbalances may involve the use of herbs and acupoints to tonify and regulate qi and blood in the body. There are 14 main meridians on animals' body, including lung meridian, we call LU, large intestine meridian, LI, stomach meridian, ST, spleen meridian, SP, heart meridian, HT, small intestine meridian, SI, bladder meridian, BL, kidney meridian, KID, periculum meridian, PC, triple heater meridian, TH, gallbladder meridian, GB, liver meridian, LIV, governing vessel, GV, conception vessel, CV. The lung meridian controls how energy is consumed and impacts the respiratory system. The large intestine meridian regulates the processing and extraction of water from waste. The stomach meridian regulates the extraction of nutrients from food, nutrient distribution to the intestines and spleen, and the overall digestion of food. The spleen meridian regulates transportation and absorption of nutrients, usually translated with food incense and water. The heart meridian regulates the circulation of blood to all organs. The small intestine meridian is responsible for digestion, water absorption, nutrient absorption, and bowel functions. The triple heater meridian regulates the metabolism of the body and promotes general wellness. The blood meridian regulates the removal of the toxins from the body. The gallbladder meridian regulates the removal and storage of toxins that are produced by the liver. The kidney meridian regulates the reproductive system, testosterone levels, produce bone marrow and blood. The pericardial meridian regulates the qi that surrounds the heart, protects the heart, ensuring proper function and emotional balance. The liver meridian regulates the female reproductive system, circulation of energy, and maintains the flexibility of the ligaments and the tendons. And then the governing vessel and conception vessel, we call the GV and CV. These two extraordinary meridians run down the center of the body. Energetically, both meridians can address local problems along the channel. In addition, GV and CV are important because they affect the internal organs and the deepest energy in the body. From the view of traditional Chinese veterinary medicine, there are some evils may cause illness. The six evils theory is a diagnostic frameworks used to identify patterns of imbalance of disharmony in the body, and to develop a treatment plan to restore balance and promote health. They refer to 6 different patterns of disharmony or imbalance that can occur in the body, and each stage is associated with the specific set of symptoms and treatment principles. The 6 evils are wind, cold, heat, dampness, dryness, and fire. Wind can affect health. It is destructive both in nature and within body. There are 2 types of wind that we talk about, external and internal. External wind invasions gets into the pores of the skin, and a sudden illness can manifest. It can cause further damage if allowed to develop into internal wind, depleting our qi and causing problems with body. Typical Western diseases that are caused by wind include vestibular syndrome, dizziness and vertigo, Meniere's disease, tremors, spasms, and shaking. Severe wind can also cause a stroke. Therefore, if we want to treat vestibular syndrome, we could do laser and acupuncture on the head and around the ears. It helps improve local blood circulation, promotes the self-repair of balance system, and alleviates symptoms caused by abnormalities in the vestibular nerve. Of course, we can also give appropriate traditional Chinese herbal medicine to the animals. Laser, acupuncture, herbal medicine, all of them can help nourishing in, pacifying the liver, extinguishing wind, promoting blood circulation, and resolving qi stagnation. This gradual approach aids in recovery of the body and helps prevent recurrence. How to do acupuncture in animals? In acupuncture, needles are inserted at specific acupoints, which may be manually stimulated in various ways, including gentle tweeting or up and down movements. In addition, the depth of needle penetration is also manipulated by acupuncture veterinarian. The animal may feel sensations of the qi, which are feelings of pressure, warmth, or tickling in the superficial layers of the skin. Acupuncture involves the insertion of very thin needles through skin at acupoints on body. A key component of traditional Chinese veterinary medicine, acupuncture is most commonly used to treat pain. Increasingly, it has been used for overall wellness, including vestibular syndrome. Traditional Chinese veterinary medicine explains acupuncture as a technique for balance the flow of qi, which is believed to flow through meridians. By inserting needles into specific points along these meridians, qi and energy flow will rebalance. Many theories to explain how acupuncture works have been proposed, including the gate control theory of pain and the endorphin and neurotransmitter model. Acupuncture may modulate transmissions of pain signals and alters release of endogenous endorphins and neurotransmitters, resulting in physiologic changes. The risks of acupuncture are low. Common side effects include soreness and minor bleeding or bruising where the needles are inserted. Single-use, disposable needles are now the practice standard, so the risk of infection is minimal. Unfortunately, not every dog and cat is a good candidate for acupuncture. This depends on their temperament. If their temperament is unstable, there is a possibility that the veterinarian may get bitten or scratched during the acupuncture process. The cat in the video has a very stable temperament. Even with near 20 needles inserted into its body and added electrical stimulations, it remains unfazed. In my own experience, only about 20% of cats can be so obedient during acupuncture. In addition to needles, stimulation of the acupoints can also be triggered through laser. Low-intensity lasers can be used directly on the acupoint for treatment. In contrast to needle acupuncture, laser acupuncture is non-invasive and can be a more feasible treatment for animals. Typically, patients do not feel any sensations when a low-light laser is used. Perhaps the greatest advantage of laser acupuncture is that it's completely painless. Most patients feel nothing at all during laser acupuncture, but it is believed that some may feel a chi shift in their body or an energetic sensation propagating along the meridian being treated. The non-invasive nature of laser also minimizes the risk of adverse events, such as organ puncture, infection, or bleeding complications. Laser also facilitates stimulation of areas that are difficult or uncomfortable to needle, such as auricular acupoints. By using a multi-channel laser system, multiple acupoints can be treated simultaneously, just in a metal needle acupuncture treatment. The main advantage of laser acupuncture over traditional acupuncture are shorter session lengths. It is fast and easy. We are talking seconds in comparison to needle retention time, which may be 10 to 20 minutes. Laser acupuncture is shown to be as effective as needle acupuncture for a variety of problems. Laser acupuncture is a gentle and effective alternative to traditional acupuncture, and as such is particularly well suited for use on the young, old, or nervous. The next part is laser therapy. Laser or light amplifications by stimulated emission rays is a means of directing highly concentrated coherent light at a concise wavelength to the muscles, tissues, organs, connective tissue, form elements of the blood and the living matrix of the body. Laser light then communicates to the cells on a very basic and powerful level. There are many reasons that the laser therapy works on the structure and metabolism of living tissues. Effects at the cellular level. Light at the proper wavelength repairs mitochondrial DNA and messenger RNA used to support and direct maintenance and metabolism in the cell. Effects at the organ level. Combined effects of rehabilitation of cell and connective tissues repaired by laser light. Effects at the symptomatic level, resumption of proper organ function. Effects at the therapeutic level, as the organs heal, the symptom will resolve. There are three main effects of laser therapy, including pain relief, anti-inflammation, accelerating tissue repair, and cell growth. Laser decreases nerve sensitivity by decreasing breaking. It normalizes ion channels and releases endorphins and enkephalins that produce an analgesic effect. And the light from the laser can decrease the release of pro-inflammatory chemicals, thus reducing the inflammatory signals in the region. Laser light stimulates fibroblast development in damaged tissues, and photons of light from lasers penetrate deeply into tissue and accelerate cellular reproduction and growth. The power density of the laser defines as the laser energy supplied per area. We usually call it 4 watts per square centimeter. It influences its depth of energy penetration. For example, a 15 milliwatt laser with a beam size of 1 square centimeter has an energy density of 0.005 watt per square centimeter, whereas the same power laser with a beam size of 1 square millimeter has an energy density of 5 watt per square centimeter. A higher energy density results in deeper energy penetration through skin. Energy transmission through the skin is also affected by absorption of light energy by skin structures. Light wavelengths from 650 to 900 nanometer have the best penetration through skin. Lower wavelengths are absorbed by melanin and hemoglobin, and wavelengths longer than 900 nanometer are absorbed by water. With a well-focused laser beam, red wavelengths can penetrate 2 to 4 centimeters beneath the skin surface, and infrared wavelengths can penetrate up to 6 centimeters. Because the irradiation from laser could potentially cause serious eye damage, therefore animals and veterinarians must wear protective eyewear during treatment. In addition, other precautions should be undertaken, including not directing the laser toward the fetus if a patient is pregnant, not irradiating the part region of patient with cardiac conditions, and avoiding hemorrhagic areas and the gonads. Direct irradiation of tumors should be avoided because it may stimulate their growth. Then, where are the acupoints of animals? Most acupoints are located in relation to musculoskeletal landmarks, so a brief review of some pertinent anatomy of the dog is necessary. The Chun body inch is a measurement relative to the dog's body size. It is used to find acupoints. It is easy to remember that the widest part of the shoulder blade is 3 Chun. This is the most important measurement. The size and shape of canine limbs differ significantly, which makes the transposition of some acupoints challenging. Since the Chun is a proportional measurement, the size of one Chun varies greatly depending on the length of the limb. For example, the distance from the elbow to the carpus is 12 Chun in dogs, which may be 6 centimeters in a Chihuahua and 50 centimeters in a Great Dane. Then I will introduce some acupoints that I often use in vestibular syndrome. The first one is GB20, Fengchi. It is on the dorsal of the neck, in the large depression just caudal and lateral to the occipital protubulance median to the cranial edge of the wings of the atlas. Attributes and indications are crossing point of the GB and Yang Wei meridian, external wing, internal wing, cervical pain, intervertebral disc disease, epistaxis, nasal discharge or congestion, epilepsy. GB14, 大椎, on the dorsal midline in the depression in front of the dorsal spinous process of the T1 vertebra. The first palpable dorsal spinous process going from cranial to caudal. Attributes and indications are crossing point of the GB with the 6-yang channel, clear heat, indeficiency, fever, cough, dyspnea, cervical pain, intervertebral disc disease, dermatitis, epilepsy, immune deficiency. GB12, Shenju, on the dorsal midline in the depression between the dorsal spinous processes of the T3, T4 vertebra. Attributes and indications are cardiopulmonary disorders, cough, epilepsy, intervertebral disc disease, Shen disturbances. LI15 Genjing, at the shoulder region, cranial and distal to the acromial on the cranial margin of the acromial head of the detailed muscle. Attributes and indications are shoulder pain and lameness, cervical pain, intervertebral disc disease. GB20, 百会, on the dorsal midline on the line drawn from the tips of the ears level with the ear canals. Attributes and indications are crossing points of GB and BL channels, sedation point, Shen disturbances, epilepsy, sleep disorders, prolapse of the anus. GB8, 帅骨, on the dorsal of head, 1.5 turn medial to the middle of the ear base. Attributes and indications are ocular disorder and cough. TH17, 一风, caudal-ventral to the base of ear, in the depression between the mandible and the mastoid process. Attributes and indications are crossing point of the TH and GB meridians, otitis, temporomandibular joint pain, cervical pain, intervertebral disc disease, facial paralysis, swelling in the face. The next one is 颈闸肌, cervical paravertebral point. 2 rows of acupoints on the lateral aspects of the cervical region, 0.5 turn above and below the lateral processes of each cervical vertebra. Attributes and indications are cervical pain, cervical intervertebral disc disease, cervical spondylomyelopathy. So please remember these acupoints. They are useful for vestibular syndrome. Okay, let's go into the last part, case reports. Case number 1 is spayed female Shiba Inu, 14-year-old. Chief complaints are head tilt and head turn for a week, vomit often and drooling, and it has poor appetite. I did some basic examinations first. I checked the ears, but no specific finding. Blood exam shows neutrophilia, and X-ray only shows spondylosis of lumbar spine and degenerative arthritis. So, in my opinion, it is supposed to be idiopathic vestibular disease. My treatment for it, including acupuncture, laser therapy, herbal medicine, and Western medicine. I did acupuncture and laser on GB20, GB14, LI15, GB12, GB20, GB8, TH17, and Jinjaji, just like I mentioned before. The herbal medicine I used were 半夏白术天麻汤 and 补阳黄武汤. For stopping the vomiting and nausea, I get Maropitant once a day. After 2 weeks treatment, the patient could walk well, though still a little bit head tilt. However, it could already lead a normal life for the most part. My suggestion is to do laser once a month for degenerative arthritis. This will help the patient work better in the future. Case number 2 is a mixed intact male, 40-year-old. Chief complaints are head tilt, ataxia, and nystagmus for about 3 days. This video shows nystagmus. So I also did some basic examinations, and I found severe otitis of both ears. It may be the reason why the patient had vestibular syndrome. Blood exam shows neutrophilia, and X-ray only shows spondylosis of lumbar spine and degenerative arthritis. So my diagnosis for the patient is peripheral vestibular disease. My treatment for it, including acupuncture, laser therapy, herbal medicine, and eardrops. I did acupuncture and laser on the same acupoints I mentioned before, but the owner was very busy, so the patient only come back to my clinic and do the treatment once a week. The herbal medicine for this patient, I prescribed 十味败毒散 and 天麻勾藤饮. To treat otitis, eardrops containing miconazole, prednisolone, and polymyxine sulfate are given twice daily. This picture shows the acupoints I used for this patient. It's a round head and ears. After 3 weeks treatment, the patient could walk well without ataxia, and the otitis also recovered completely. My suggestions are keeping ear clean and checking ear condition regularly, avoiding recurrence of vestibular syndrome. So, in conclusion, vestibular syndrome may present obstacles, but with acupuncture, laser therapy, and other supports, we can make a substantial difference in lives of those affected. Thank you for your time and attention, and I invite any questions or discussions you may have on this subject. Thank you.
Okay, thank you very much, Dr. Lin, for your wonderful talking. And I'm sure you will have a lot of questions for Dr. Lin. And now it's time for the question and the answer part. And now we already have 6 questions in the area. Please feel free to ask Arjun. Okay, let's just invite Dr. Lin to answer your questions.
The question number 1 is, could the meridian system be realized as nerve system in Western medicine? If not, what is the difference? In my opinion, the meridian is invisible lines in our body and in animals. It is relative to the nerve system, but not totally the same as the nerve system. It not only the nerve system, and then also the blood circulation and the muscle and the bone. So it is a very abstract. So maybe we should talk another time for the meridian because the meridian and the acupoints are very complicated. Okay, so the question number 2. Does sedating the animal affect the efficacy of acupuncture? For me, I don't do sedation when I do acupuncture because if the sedation was did, I cannot feel the chi feeling on the muscles. So in my opinion, I think sedation may affect efficacy of acupuncture. I suggest do not sedating when you do the acupuncture. The question number 3 is, do you continue the acupuncture therapy with higher frequency or modify the treatment plan to other kinds of therapy if the former show limited effects? In my experience, I usually do acupuncture twice a week if the patient is vestibular syndrome. But if the patient didn't show any improvement, maybe I will suggest to do further examination. Is, for example, CT scans or MRI to check if there are still another problems of their head or other exist some problems. So I won't continue to the acupuncture therapy all the time if the patient didn't show improvement. Next question is, are there any side effects of this therapy? When I am treating animals, the probe sometimes will overheat. It depends on the machine you used. In fact, most laser will provide heat. So if you do the laser therapy, please just move around the body. Don't just don't just do one spot because it usually to overheat. So if you control the heat well, it will be safe. Next question is, I am a vet from China and I am wondering if we can use laser on acupuncture part. Yes, my answer is yes. You can use laser on the acupuncture part. The next is, how long can we see the effects of laser? It also depends on the symptoms of the patient. For me, if the patient is vestibular syndrome, most of them will recover in 2 weeks. So if more than 2 weeks you didn't see any improvement, maybe it needs some further examination. The next is, if it's possible to recommend the pet parent rent a laser for the patient and use it at home, my answer is no, because just I mentioned before, laser machines sometimes will overheat. So if the parent, the owner use it at home by himself, maybe the side effect will show. So it is better to do the laser therapy in clinic by veterinarian. The next one is, laser therapy can accelerate microcirculation For septic wounds, it's possible that laser will induce bacterial multiply and accelerate bacterial moving to other areas with blood flow. My answer is no, because in my opinion, laser do the effects more than the bacteria of our animals' cells. So when we do the laser therapy, the animal, maybe the immune system will upgrade than the bacteria. So it will improve the immune system to kill the bacteria. So the bacteria won't moving to the areas with the blood flow. The next is, here is a question from, does the same acupuncture easy to do in cats? Yes, my answer is yes, because if the cats also show the vestibular syndrome, I always use the same acupoints. But the cats often not the good temperament, so please be careful. The next is, what parameters that you use for laser acupuncture per acupoint? For example, frequency, time, power. Oh, it's a good question. I usually use laser acupuncture by a 4 joule per square centimeter, and each point about 4 seconds. And so it's very quickly to complete the 4 sessions. And I will do it laser therapy, laser acupuncture about 2 or 3 weeks per week. The next one is, how many times should we do for acupuncture therapy? In your case, you use once a week. What if we doing that 3 times a week or more? In my opinion, the laser therapy will promote the self-repair. So once we do the laser therapy, we need to give the body more time to repair itself. So if you do laser every day, in my opinion, it will, the body will have not enough time to repair itself. So I always recommendation to do laser therapy about 2 or 3 per week. But if the patient is, the owner is very busy, at least I suggest to do once a week laser therapy. It's okay. The next is, can acupuncture combination with electroacupuncture for vestibular syndrome? Thank you. Yes, electroacupuncture is more electronical stimulations, but in my opinion, because when the patient have vestibular syndrome, it is always very nervous. So if you add electrical stimulation, it will more pain. Maybe it is more pain. So in my opinion, I always usually acupuncture instead of electroacupuncture. Okay, the next one is, with head tilt cases with nystagmus present and laser and head acupuncture is chosen as the treatment method. But because it is the first treatment session, how we know if there might be a brain tumor? If there really was a brain tumor, with just one session of laser and head acupuncture point can cause the tumor to grow aggressively. If there is a brain tumor, only one time laser therapy, I guess it won't make the brain tumor get bigger very quickly. But if you suspected the brain tumor in the patient, please stop laser again. Okay, I finished all the questions. Any questions?
Okay, thanks, Dr. Lin's answer. Thank you again for your time and attention. Bye.